Turning 65 is a major milestone, especially when it comes to your health coverage. Medicare starts when you reach this age. However, if you're still working, you might be wondering if you need to enroll right away or if you can wait. Making the right decision is crucial because it can have long-term effects on your healthcare costs and coverage. One of the biggest mistakes people make is delaying enrollment in Medicare Part B, which could lead to penalties that last a lifetime. When you're approaching 65 and still actively employed, deciding when to enroll in Original Medicare depends on several key factors. If you work for a company with 20 or more employees, you have more flexibility. Your employer's group health plan will remain your primary insurance, and you can delay enrolling in Medicare without penalty. However, if your employer has fewer than 20 employees, Medicare usually becomes your primary insurance at 65, regardless of your employment status. In this case, you should enroll in both Part A and Part B during your initial enrollment period to avoid coverage gaps and late enrollment penalties. One of the biggest concerns with delaying Medicare enrollment is the risk of penalties, especially with Part B. If you don't sign up for Part B when you're first eligible and your employer coverage isn't considered creditable, you could end up paying more for the rest of your life. The penalty for late enrollment in Part B is an additional 10% for each full 12-month period you could have had Part B but didn't. This penalty is added to your monthly premium and is paid for the duration of your Part B coverage. If you're considering alternatives to Original Medicare, you might want to look into Medicare Advantage plans, also known as Part C. These plans combine Part A and Part B, often with additional benefits like dental, vision, and prescription drug coverage. Medicare Advantage plans can sometimes offer better benefits than what you're currently getting through work, especially if your employer's insurance doesn't include dental or vision coverage. When it comes to prescription drug coverage, if your employer-sponsored plan includes creditable coverage, you can delay enrolling in Part D without penalty. However, if your employer's drug coverage isn't creditable, or if you don't have prescription drug coverage at all, you should seriously consider getting Part D when you're first eligible to avoid late enrollment penalties. If you're leaning toward Original Medicare but worry about out-of-pocket costs, a Medicare Supplement plan, often called Medigap, might be a great option for you. These plans are designed to cover some of the costs that Original Medicare doesn't, like co-payments, co-insurance, and deductibles. The best time to sign up for a Medicare Supplement plan is during your Medigap open enrollment period, which starts when you're 65 and enrolled in Medicare Part B. When you're still working at 65, figuring out whether to sign up for Medicare can feel like a big decision, but it's crucial to get it right. If you're unsure about your options or need help deciding between Original Medicare, Medicare Advantage, or Medicare Supplement, it's a good idea to get professional guidance. A Medicare expert can help you weigh the pros and cons of each choice based on your specific needs. For more information about Medicare, please speak with a Senior Healthcare Solutions Medicare expert today at 866-633-4427. Thanks for watching. Like and subscribe for more Medicare videos.